Good afternoon and welcome. My name is Tim Poe. I'm Director of Telehealth with the UNC Cancer Network. Let's see, I think we're all set here. We're trying a few new things, so bear with us. Hopefully you can hear us, see us. Everything is going to work perfectly. If you've been with us for the last lecture, you know we were running into a few audio issues, and we think we have that taken care of, but we'll know for sure today. But you can reach out to us at 919-445-1000 if you are experiencing any technical difficulties at all. Also, unccn@unc.edu. As always, you can find out a lot of information about us on our website, unccn.org. We're on Facebook. We're on Twitter. We're on YouTube. We're now on ViewMedi. So we've got a lot of our videos on ViewMedi as well, and more all the time. We will be using Poll Everywhere today. We hope that you'll take advantage of that. This makes every lecture just a little bit more engaging and interactive. So what you can do, if you haven't joined us via Poll Everywhere before, this is really easy. One way you can do this is via the web. I think this is the easiest thing. Just go to pollev.com, enter the letters UNCCN, and then you'll just respond to the activities. And then at the end, you'll have an opportunity to ask questions of Dr. Yopp. So you can be jotting down questions somewhere, and then we should have some time for him to answer those at the end. If you want to do this by text, you can use a phone that has a texting capability. In the to area, you're going to put in UNCCN going to the number 22333. You'll text UNCCN to the number 22333. You'll get a message back saying that you've joined, and then you can put in the letters corresponding to the correct answers and then share your questions at the end. There's also an app, free Poll Everywhere app, and you can use that. Just put in the letters UNCCN. All of this is, as always, free. So we've got live lectures, patient-centered care every second Wednesday, research to practice every fourth Wednesday. All of our courses go online as self-paced online courses, and you can receive credit there as well. You can also visit our media site library, our YouTube channel, etc. So without further ado, I would like to introduce our guest today, Dr. Justin Yopp. Thank you so much.
Yeah, absolutely. Glad to be here.
Glad to have you here. Let's see what we know about you. We know that you are a clinical psychologist and associate professor in the Department of Psychiatry at UNC.
That's correct.
Okay, good so far. Member of the UNC Comprehensive Cancer Support Program at the North Carolina Cancer Hospital, where you provide inpatient as well as outpatient assessment and therapeutic services.
So
Two
far,
for
so
two?
good. 2 for 2.
Okay, and you work with children whose parents have serious medical illnesses such as cancer.
I don't know how the audio is working, but as far as your introduction, you're spot on.
Good, good. So what am I missing? What's something we should know maybe outside of this realm?
It's a good question. I guess one thing that we have that we do here that I'll get into a little bit later in my talk is working with parents who have lost a spouse, usually to cancer, either a husband or wife or a partner, and are raising kids at home.
Okay.
And it's really something we've been doing for almost 10 years here now at UNC, after really realizing there was an unmet need, and almost across the country there's virtually zero support and research for widowed parents. So we have a whole program, research, support group. We give lectures. Recently did a TED Talk. We kind of try to get the word out there for the unmet needs for widowed parents, and really all we have to do to try and meet those.
Well, thank you. Thank you for doing that, and we'll look forward to hearing more about that.
My personal note was going to be that I'm actually an NC State fan.
Oh,
Yeah,
okay.
Sometimes it doesn't go over too well here, given where I work.
No, we'll take that.
No,
this is North Carolina.
Well,
we're North Carolinians all throughout here,
right.
and I hear they're doing pretty well this year.
Doing okay.
Well, better than usual.
Better than usual. Better than Carolina. Not usual.
Yeah, no. All right. Well, let's see. Here's that poll. I think that most of you are going to be able to get this. Patients dealing with cancer can benefit from support network of some kind, true or false. So we're using Poll Everywhere. If you believe that this is true, an A. If this is false, a B. Again, this is anonymous, but I think most folks are going to get it. And while you're doing that, I'll read our disclosure. This activity has been planned and implemented under the sole supervision of the course directors in association with the UNC Office of Continuing Professional Development. William Wood, MD, MPH, and CPD staff have no relevant financial associations with commercial interests as defined by the ACCME. Justin Yopp, PhD, has no relevant financial relationships with commercial interests as defined by the ACCME. Whew, did it.
All right.
And looking at our poll, I think we're on a roll here.
That's good, because if the answer was B, this would be a short talk.
Yeah.
So,
Well, or maybe even a longer
or
talk.
maybe a longer talk. Yeah, I don't know.
All right. Well, without further ado, let me pass the controls over to you.
Thanks.
The role of patient support networks in cancer outcomes with Justin M. Yopp, PhD.
So as Tim said, I am a psychologist, and I work here at the Cancer Hospital here in Chapel Hill. And as a psychologist, I do some research and other things, but primarily I'm on the front line seeing patients, both pediatric, adolescent, young adults, and adults. And so that's kind of where my bread is buttered here at the hospital. And so I was honored and happy to give this talk when Tim asked me. Certainly, I firsthand see the benefit of support networks every day, and think this is a good thing for us to chat about today. So, real quick, I have one disclosure. It's the book that we wrote about the fathers from our first support group. It's just for royalties, but any royalties we make goes back to our program anyway. But I am obligated to put that up there. All right, so here's kind of what I want to talk about today. Just a brief outline, and I want to give people a sense of what the research shows as far as what kind of social support networks, kind of how we look at those, what those offer people, what's the impact that people receive from those, either at diagnosis, throughout treatment, into survivorship. And when we talk about social support, that's a pretty broad term, right? That could be a lot of things, and certainly 50 minutes is not enough to go over all of that and to get into every nook and cranny on that. But I would like for everyone out there to go away with the sense of a little better understanding of what we provide for patients, what we can provide for patients, and maybe what we should provide to patients and family members at each of our respective locations. All right, so this just kind of gets at the first poll question, right? Social support networks, they sound helpful, right? Like, are they good or are they bad? I think, at least according to the poll, everyone that answered said that they are good, and they certainly sound helpful, right? And are they? That's kind of the question, right? And if so, in what ways are they good, and what kind of social support do our patients and our caregivers benefit from the most? And the good news is that the research does bear out, I think, what a lot of our clinical experience would find, and what our instincts and what our hunches would say, and that is that social support has been linked to all the things you see up there, and these are all measures of or outcomes of psychological distress or outcomes in some way. And so patients who have cancer, being treated for cancer, who are receiving what they perceive sometimes to be, at least perceived to be, good social support, have been found to have lower rates of anxiety, depression, post-traumatic stress disorder symptoms. You see there the second bullet point, better adjustment to illness and treatment. And what that PTG is, that's post-traumatic growth, which is kind of an interesting construct in of itself. It's a little bit of the flip of post-traumatic stress, so that you go through something very stressful, very overwhelming, such as being treated for cancer, and you may have PTSD, which is you become stressed, you become traumatized in some way. Kind of the flip of that is that you may grow from that, and it may be a growth experience, not one that people say that they're glad they had, or that they wouldn't trade for not having that growth, but that people do grow in ways that maybe are unexpected, at least at the beginning of their illness course. And people who have good social support are more likely to see that kind of growth. Greater psychological resiliency, which is a little bit, at least a cousin of post-traumatic growth. A sense of empowerment, and related to that would be kind of a sense of self-efficacy, a feeling of I can do this, which I imagine all of us know that or have experience with our patients, that when patients kind of have a sense that they can do this and they can get through these times, that really helps. And for people who have established or new support networks within the hospital are more likely to have that feeling of empowerment and that sense of self-efficacy, and better quality of life. That's another one that's been found within the research as well. But social support networks, we haven't just looked at their benefits on our psychological coping and functioning, but also medically, right? Does it help? Does it help with the medical side of treatment? Does it help with cancer outcomes in that respect? And there has been some findings to show that people who have good social support networks or have a better grasp, a better understanding of their illness, of their treatment. They have better adherence to their regimen. They show up for clinic appointments at a higher rate, and really kind of get through treatment in that way, not just coping better, but actually adhering to treatment and understanding the treatment that they're going through. And there has been some, I wouldn't say overwhelming, but there has been some, there's been some solid data to show that social support networks, particularly as it relates to being married, and we'll get to this in a minute, is related to lower mortality rates and lower morbidity rates. And that's not nothing. And the bulk of that research, at least in terms of my looking at the literature, is that really gets at whether or not people are married or not, and the differences there. And like I said, I'll get to that in a second. So there's been quite a bit of research in this area, and there's a lot of different theories of how social support may engender better psychological outcomes or lead to better medical outcomes. And it's certainly beyond the scope of this talk to get into each of those. And at least in my reading of the literature, there's not one that is kind of heads above the rest. But in general, I think the way that some people have looked at it is that when you receive support from others, whether it's from peers, whether it's from family, that at least helps with the uncertainty that's brought about by a cancer diagnosis, right? Everyone knows, of course, when you're diagnosed with cancer, and I see this in my world every day, life is upended. Nothing feels normal anymore. There's a very clear kind of delineation of life before cancer and life now. And with that comes with it, of course, a lot of uncertainty. How do I get through this? What questions do I ask the doctors? Do I have the capability? Kind of questioning whether or not you can do this. And that kind of uncertainty can be tamped down if you have people in your social support network. And look, this is not rocket science, right? And there's some research to show that and some theories to that posit that. And I think that's probably in line with what most of us would expect. And then also that support, if at least that, less uncertainty and a greater sense of self-efficacy, then that reduces further distress that comes down the road, like once you encounter side effects, whether you get news that's not as encouraging as you're hoping for. If we have support to kind of buffer us against those to begin with, that can set us up to have less kind of compounded distress as we go through our treatments. All right, so there's two broad types of support networks as far as how people look at the literature, and I think this makes sense too. Excuse me. One is embedded, and the other one is peer support. A little heads up for a further question, you might want to remember this one, embedded and peer support. So what are we talking about here? So first, let's talk about embedded. This is really what the kind of support networks that people when they come in and the first day they're diagnosed and they start their treatment, what social support networks do they already have in place? So we're talking family, we're talking spouses, partners, children, friends, neighbors, church community. Kind of what do people bring to the table on the day of diagnosis? And this is, of course, something that we as providers have very little impact over, right? This is kind of people come to the table with this, and they almost either have this or they don't. So the first one is embedded. Let's talk about that one for a second. So again, I don't think this will come to any surprise to anyone that people who have stronger embedded social support networks are more likely to have better adaptation during their cancer treatment, have lower levels of distress across anxiety, post-traumatic stress, depression, and a lot of the research, some of the research shows that it does have lower mortality rates and better treatment adherence. And this is really, there's been a few studies that have looked at this across different cancer types, men and women, people who are married and people who are not married. And are there differences in survival rates for these people? And the data have been clear that if you are married, you have a lower risk of dying from cancer, which is pretty amazing, right? I mean, I think on some level it makes sense. On another level, you see the rates down there for married men. The largest study that had, I forget the number, but thousands of people found that married men were up to 24% less likely to die than unmarried men. And you see a little bit lower percentage there for women, but generally the same story. And to me, at least, that's a pretty eye-popping number. Of all the things that we can do to mitigate someone's risk to dying from cancer, a really big one is whether they're come into the situation married or not. And different, I think, theories kind of are behind what is it about being married that leads to greater survival, and what is it about men being married? And I think at least one common thought is that men maybe need a little more pushing and shoving to get into clinic appointments, to take their medicine, and if they have someone who is a life partner and who is otherwise invested in them doing so, they're more likely to do it. Tim's over here laughing when I say that. I think that's probably a lot of us can understand that would be true, and certainly kind of have seen that in my experience. So that kind of embedded support you see there makes a lot of sense as to why that would relate to better outcomes. But, we don't have much say in that, right? People come to the table with this. We don't set people up to get married. We don't. So what can we as providers, either as healthcare providers or mental health care providers, what can we do on the embedded support side? How can we help patients in that way? And, here's a few things. I mean, patients come to the table with what they have, but that doesn't mean they use that support as well as they could or as well as they always should. And so, I have up there encourage them to accept the support. And that's, I could go through case study after case study of people who are newly diagnosed who don't want people to know and try and keep their illness quiet, or just within the confines of the hospital, clinic, or in the inpatient rooms. And once I'm out, I try not to think about it, and I don't want to involve people, and I don't want to receive help from others. This is especially true for men, right? We know from the research that men are less likely to ask for support in times like this, and are less likely to accept support when it's offered to them. So just because someone comes in with a strong social support network does not mean that they are necessarily accessing that care or accessing that support. And to whatever degree, we as providers have some influence over that, I think that's always something to keep an eye on, is how much, to what extent people are willing to lean on people. And look, this is kind of a blanket recommendation and thought, and there are certainly some support networks who may not be all that supportive. And it may make a lot of sense for patients to not include their parents or their in-laws or their neighbors for some reason, and that may make perfect sense. But I think it's incumbent upon us to make sure that people aren't unnecessarily cutting off support that they may access, especially when we see its positive benefits. Involve that embedded support, within care. Certainly encourage loved ones and spouses to come in during clinic and hospital visits, right? That is no secret either, right? If you have someone who's with you, how many times have you guys heard, I know I have, that if someone comes in, especially for a big discussion with their oncologist about changes in treatment plans or prognosis, that they walk out of the room, and sometimes I'm present in those conversations, and they walk out of the room and retain a fraction of what was said to them. And that is understandable and normal, and fine, because it's a lot of information that you're getting at a time when you're high stress. So encouraging and not mandating, but really strongly encouraging having someone, whether it's your wife, your husband, or your partner, or whether if you don't have that, whether it's a brother or sister or a neighbor or someone from church, someone to be an extra set of ears and eyes to help understand what is said to them, help advocate on the patient's behalf, and then provide support before, during, and after that visit. That's invaluable. And so even though we can't really change and shape that embedded support that patients have, we certainly can influence and encourage and give patients permission to access that support along the way. Oh, here's one of the quizzes.
All righty. Yeah, this is our first. So I'll go ahead and turn it, and looks like we already have a response there. But they've been able to see this ahead of time. So which is not a type of support network?
I almost forgot that I said not.
So A would be embedded, B is logistical, and C is peer. So go ahead and take your best guess at which one is not a type of support network, embedded, logistical, or peer. Let's give them a few more seconds. And I see somebody updated their answer. That's okay. So,
wow.
All right. So how are we doing?
So, yeah, doing good. So everyone got it right.
Good.
I figured we've all been to school enough. I didn't want to make these too hard, and obviously this one wasn't too hard. So, yeah, embedded and peer. And we just got done, of course, talking about embedded, so let's talk about peer. And this is really more what we can offer and the kind of structural support that we can put in place for our patients. The kind of support that we have more control over. And really what we're talking about here are peer support in terms of one-to-one support programs and support group programs. And I'll go through kind of each of those, a little bit about what the research says, and then more about how we can implement that and what are some of our experiences here in Chapel Hill, success stories, and I can talk about some that were not as successful in kind of implementing these. All right, so peer support, right? In its simplest form, what we're talking about is support that one cancer patient receives from another cancer patient and or survivor. And I've seen in different ways how this is, there's no other kind of support like this. No one, the kind of the cliched, no one understands what I'm going through. It may be cliche, but it's true, and it carries some weight. But talking with and connecting with people who are in the same boat or who have walked the same path as you can lead to a unique kind of support that you really can't get in any other kind. And whether that is through a one-to-one kind of peer mentoring relationship, or whether it comes within a support group setting, there is just quite simply something about sitting with and being with people who are in your shoes that's just invaluable. And it's not just the opportunity to receive support, but it's also the opportunity to give support, right? We see this in all the time in the support groups that we run. People might kind of come for the idea that they need some support, and that's why they got dragged to the support group in some ways. But what they end up kind of leaving with is also this sense of that I was able to give back and help someone else. Because you're going through cancer treatment, you're on the receiving end of a lot of things, right? You're getting help from others, you're getting casseroles from your neighbors, you're getting chemo from your doctors, you're kind of getting and receiving, and you may not be able to work and produce and provide like you're accustomed to doing so. But within a support group setting or a one-to-one peer setting, being able to help someone else who is in need can really be a boost and can really add to a sense of value offered and a sense of self-efficacy that you have something to give and that you're not just on the receiving end of support. And you see there that peers can offer instrumental and emotional support both ways, from diagnosis all the way to survivorship. So these can originate organically or through hospital programs or outside organizations. The organic peer support that I'm witness sometimes, and sometimes people who have long inpatient stays will get to know each other a little bit. But that's pretty rare, right? When people are in the inpatient units, they're mostly confined to their rooms. They may not be feeling well. They don't want to go out. Of course, there's, risk of infection. So there's kind of this sense of staying in your little cubby. So there's not a whole lot, at least in my experience, of peer connections that just happen organically. Sometimes I think more with spouses and caregivers who have a little more freedom to move around the hospital. Sometimes they'll find each other. But at least in my experience, it doesn't happen too often. The hospital programs, some of the ones that we have in place in Chapel Hill and others have in place elsewhere, is I think really what is the main, vehicle for getting patients together to connect with each other. And I'll go through those in a minute. But those are, if you think about it, those are really, really preferred by hospital healthcare systems to either do support groups or to do one-to-one peer support kind of mentoring programs, because they're very cost effective, right? There's a lot of things cost a lot of money around here in the healthcare business. This doesn't cost a lot. And so there's few financial barriers that are in place usually. And there's the perceived benefit, of course, for the patients, right? This is something that is not hard to understand, how connecting with others in your situation, how that would be helpful. It just makes some intuitive sense. And so I think there's logistical hurdles to setting these kind of organizations and these peer relationships, up, but I don't think that there's a lot of kind of institutional roadblocks, at least that we found here in Chapel Hill. Yeah.
All
Well,
right.
I set this one up on a tee.
So here we go. So let's see. There seems to be a little something up with our, there we go. Should be able to see that now and go ahead and respond to that. So peer support programs are often preferred by hospital systems because they are not expensive. The perceived benefits for patients, physicians lead the groups. And let's see, for some reason it looks like we may not, it's freezing a little bit. So I'm going to try and see what we can do to make sure that you can see that, because you should be able, let me go back and jump in there. All right. I apologize if it's not doing everything it should. Let's try one more time and see if we can open that up to you. It's having a little bit of trouble activating for some reason. Bear with me. I'm actually seeing, so I think they're seeing it. I think we're just, for some reason, it's not making it through quite the way it should. So right now, looking at the responses on my computer, I can see that no support has about 15%. Some, but not, no, yeah, it's still, for some reason, it's having trouble with that poll. Let me see if I can
Pretty
get
sure everyone's
back there. Yeah, let's try one more time. Activate, show response. There we go. Got it. Sorry about that. All right, so there we go. And we'll leave it up for a few more seconds. Sorry about the little glitch there. But peer support programs are often preferred by hospital systems because A, not expensive, perceived benefits for patients, or physicians lead the group.
There's two right answers, and everyone's getting the right answers.
Good.
Right? They are, not expensive and have the perceived benefits for patients and caregivers.
Okay.
So I think the question is, certainly there's this perceived benefit, right? People should benefit from having these peer relationships. The question is, has the research bear that out?
Yeah.
Which, of course, leads into my next slide.
There you go.
The quick answer is yes. Well, first of all, before I kind of get to what the research has found, there has been the impact of peer support has been studied for, as you see there, different types of cancer, certainly with breast and prostate cancer being the most commonly studied, different ethnicity groups, within adolescent and young adult population, within parents of children who have cancer, caregivers in general, and bereaved family members. So the idea of peer support researching and looking at peer support either through one-on-one or through a support group model has certainly been looked at pretty extensively and across different slices of the kind of populations that we may see. And I think it seems like generally the research is either done, you see type of cancer, it's breast and prostate. Obviously we're looking at, kind of men and women there, the most, common diagnosis, but then also looking at populations that are maybe a little harder to reach. Certainly adolescents and young adults would fit that bill. Parents of children with cancer, pediatric cancer is fairly rare, so that's a pretty small group as well. Historically, African Americans do not access mental health care, put this in that bucket, as frequently as Caucasians do. So there's been lots of different research studies, several different meta-analyses that have kind of looked at all the research studies combined and see what can come out and see kind of what the outcome is. And as you see there, at least as it pertains to one-to-one peer support programs. So these are programs that match usually someone who is a little further down the cancer road with someone who is newer on that road. And so that may be a survivor connected with someone who has, been recently diagnosed, or it may be someone who's still in treatment but months down the road and is in a position and has been screened for being someone who would be a good support for another person. And as, again, the research has, by and large, borne out what we would expect. And that is that one-to-one peer support program leads to, or is associated with lower psychological distress, sense of empowerment, greater self-efficacy, better quality of life, and of course a general feeling of connectedness with others, which would be, of course, one of the whole points of this. And so these meta-analyses get into some really heavy-duty statistical analysis that I couldn't even begin to explain. But they really take, not just look at this kind of as one database, but really take a granular look at a bunch of different studies together, and they really kind of weed out what they would call a study that may have more validity to it. And so it puts it through a pretty strict ringer, and when it does, really the results of these studies have not been overwhelmingly positive. Kind of when you read the meta-analysis, they talk about how, in general, most peer support programs find some benefits in this area, but not to the extent where it's kind of knocked the ball out of the park, overwhelmingly positive outcomes. That said, the general consensus from several of these big studies seem to be that these are certainly worthwhile programs. And anything that is low cost, that involves, activates people to be connecting with one another and leads to the outcomes that you see here more often than not, those are certainly worth doing. I think this leads into the next softball question.
It sure does.
There it is.
Okay. And so which best describes what meta-analyses have been found in regard to the impact peer-to-peer support has on patients' well-being? So no support is A, some but not overwhelming B, or C, very strong.
Seeing these questions now, and I would not have been a good teacher. Everyone would have gotten A's in my class. But look, you guys are listening, you're paying attention, and that's exactly right.
Yeah.
That by and large, the meta-analyses have found that there is some, but not overwhelming support for peer-to-peer program, enough to validate their existence, not quite enough to say that they are just, there should be a gold rush to have these everywhere and to everyone.
Gotcha. At this point, I'll go ahead and close this poll and then open up the one for questions at the end. I think that is, yeah. So I'll open that up. And so there's still quite a bit more of the lecture to come, but that way you can start actually entering your questions in Poll Everywhere, and we'll get to those at the end.
Right. All right. So we've been talking about peer support, this one-to-one peer support. And I thought it'd be nice to give you an example of what I would consider to be the top organization in the country that connects cancer patients with each other. And it's a national organization. They're based out of Chicago. And they were started, I think, in 2003, started by a young man who had cancer himself and found that there wasn't enough support for what he was looking for.
This year,
meeting
over
with peers.
1.5.
And it's called Immerman's Angels. We access them a lot here at UNC. They have a great website, immermanangels.org, I think. And here's, I think, the 2-minute video that kind of explains a little bit of their mission so you know what they offer and who they are if you think that your patients at your sites would benefit from what they offer.
500,000 people in the U.S. will be diagnosed with cancer. They will bravely make their stand to fight and survive. But one thing for sure, they never have to stand alone. They can have an Immerman Angel standing beside them, providing free, personalized connections that bring one-on-one support for cancer fighters, survivors, and caregivers. Our unique matching process partners anyone seeking cancer support with an Immerman Mentor Angel, a cancer survivor or survivor's caregiver who is roughly the same age, gender, and has faced the same type of cancer. Immerman Angels help anyone touched by any type of cancer, at any cancer stage level, at any age, living anywhere in the world, with a chance to ask personal questions, get support and empathy from someone who has been there, and help cancer fighters and caregivers navigate the system, determine options, and create their own support systems. 87% of cancer fighters have stated that relief from emotional distress would significantly improve their quality of life. To date, we've provided support to tens of thousands of cancer fighters facing over 135 types of cancer. And with nearly 9,000 mentors, we've supported cancer fighters in every state in the U.S. and more than 90 countries. But we must continue to grow. For every cancer diagnosis around the world, an Immerman Angel should be standing beside them as they bravely fight, grow stronger, and win. Please help us positively impact more cancer fighters by seeking or providing support, by giving a donation, or volunteering at an event, or running for Team Immerman Angels to increase awareness and raise much-needed funds. Immerman Angels, providing one-on-one support, information, care, a shoulder, a community, and best yet, hope.
All right, so that gives you a little idea of what this organization is about, and my experience with them has been very positive. Their website is pretty easy to to navigate, and we've connected several of our patients with people through Immerman's Angels, and it's a real help. You know, like they said in that video, they match people according to gender, age, type of cancer, and so people can really find someone in their area who has been through what they've been through and receive that kind of support. And again, that's a two-way street, right? It's not just the person receiving the support, but it's also the mentor providing it. And that can be very valuable. And I think I've talked to people in this organization before, and they've told me that a lot of the people who receive support for them go on to be mentors in the future. And I imagine that provides a lot of meaning, not just in the context of support, but gives meaning to their cancer experience in general. So that's a national organization that you can access and connect your patients with. But here's some of what we offer here at the North Carolina Cancer Hospital here at UNC. We do have a peer navigation support program. We have caregiver conversations, caregiver dinners. The caregiver conversations is basically a once-a-month meeting where anyone who is a caregiver, whether it's your son or daughter or mom or dad or husband or wife or whoever, that people can get together and have coffee for an hour and listen and provide support to one another. And sometimes that's kind of workout logistics. Usually it's just to feel less alone and to know that it's not just you, and to know that other people are struggling and other people are questioning what they're doing, and to be able to help those people and receive help from those people, I've seen to be pretty valuable. We have different support groups here. We have ones for adolescents, young adults. There are different support groups that we offer based on type of cancer. You see a few that we have up there, whether it's breast, bladder, head and neck, or advanced cancer. We have a program for siblings, for pediatric cancer patients. And then the very in there, you see I mentioned at the very beginning that we have a support program for widowed parents. These are moms and dads who have lost their partner and spouse and are raising kids at home on their own. And this is work we've been doing for 10 years, and it's a whole program now, but it really started with, first thing we did, and the real backbone of our efforts are the support groups that we have run for widowed fathers for about 10 years and have been running for widowed moms for about 3 or 4 years. And that's really, personally, that's been my most significant exposure, and really just an eye-popping experience of the kind of support that people can provide to each other in a way that they can get from nowhere else. And a lot of the patients, people in our support groups have great, embedded support, right? They have great families, they have good neighbors, they belong to organizations. Their freezers had casseroles for a year after their wives or their husbands died. They had all that kind of support. But what they didn't have was someone who was in their shoes and someone who they could say something about how they were feeling and see other heads around the table nod. And there is something about that level of connection, about that much of potentially isolating experience that has been really the highlight of my professional career. And I see the same thing with, certainly people who have cancer, but I've seen a lot of it here with widowed parents. And I think next we have a quick video that we have on our website that we put together of several of our moms and dads. Well, there's the website. Several of our moms and dads talking about exactly what being in a support group has meant to them.
This support group, I almost didn't join. A friend gave me the flyer and said, I think you should go to this. I'm not talking to strangers about this. I don't want to go to this group. And then I remember calling or emailing or something and saying, I can't imagine that there's an entire group of people out there going through this. Yes, there is. Please come to the group and talk. And to be around a table with other women who know exactly what I mean when I say, someone told me I was really strong today. And there's no words that can say how awesome it is.
There's something about the wisdom of the group that is different than the wisdom of individual people that emerges in the combination of people who are in the group. And it's not one person, it's not necessarily the facilitators of the group, but it's a collective wisdom that emerges from shared experiences that has sometimes just been really interesting to see, and you can't really attribute it to anybody, and it's I call it the wisdom of the group.
I mean, it feels like literally yesterday I walked into the room like a month after Sam passed away, and I was the new guy telling my story. And now that I've kind of cycled through and I've had other new guys come in, you realize, okay, well, hey, man, I know what you're going through. Here, might not be right for you, but here's what I did. Try it. If it works, great. If it doesn't, then, try something else. So it's been rewarding for me.
I can't imagine going through this without the group of ladies that we get to see once a month. I mean, I feel like they're my family in a lot of sense with this because we don't hang out every weekend. It's not like I call them every single day, but no matter what, I think when someone says something, we're all nodding our head or we're all saying, yes, I've been there. And just to have that validation and to know that, wow, I'm not completely off base or losing my mind, and this is normal to feel this way, and other people have felt this way. It makes you not feel so alone and isolated because you're a young widow, you're different. Things about you are different. And so to have your peer group, I mean, that's invaluable, I think. And also for me, I was the most recent widow of the group. So I was new to a lot of things, and to have people that had been through those stages to say, yes, this is what I did, or to get advice, and take it or leave it. But this is what I did has been really, really helpful. So, yeah.
The first meeting I went to, I was blown away because I felt like I knew everyone in the room, because we're all walking the same path and having the same challenges. Despite anything else that's going on, we've got the same challenges that we're working through. To me, that was the biggest part of being a part of the group, is you got something in common. I went to some of the bereavement groups, and there was loss there, but there was nobody walking the same path that I walked. And I think that was the biggest difference for me.
Finding group support to deal with my loss has been so essential, because I think one of the things that can make you feel really small in a loss, or in my experience made me feel really small, was that nobody understands. And the more you talk with other people and the farther out you get, and the fact that people don't understand how intense your grief still is, just really starts to make you feel very alone. And what I found in a group that had similar experiences was that I was not alone. I was not alone at all. And it really just gave so much validation to what I was experiencing.
All right. So that gives you some idea of what we do in the group, and kind of what it means to these moms and to these dads. And for these groups, when we run them, we throw out some pizza and some water, and we don't have an agenda. We don't have a checklist of what we do. We just let the parents start the conversation, and for the next hour and 45 minutes it goes. And whether it's widowed parents in that sense, whether it's people going through cancer treatment, whether it's people early in survivorship, whether it's caregivers, whether it's spouses, this is a lot for these families and these people to go through, and to feel like you're understood, and to connect with others either in a one-to-one setting or in a group setting. One, you heard there, it's invaluable. And two, it's not impossible, right? It's not hard. When we talked about, we can't do much about the support patients come to us with, that they already have in their lives. But there's a lot we can do to facilitate and to build support networks and platforms for people to connect during what's often the hardest time of their lives. And we've done some of that here. We could do more, and I imagine where each of you are at, you do some of that, and maybe you could do more. So I think we can't ask ourselves, what can we do to offer more in the way of peer support networks to our patients.
All right, Dr. Yopp, thank you so much. I know you have questions, so please go ahead and submit those. Dr. Yopp has references here, and if you'll submit questions, we'll start talking about those. I've got a few right off the bat while we're waiting for others to come in. So you mentioned that there's sort of medium evidence regarding the peer, and yet you listen to those testimonials and it sounds overwhelming. How is that being measured? I mean, is that being measured strictly in terms of longevity, or to what extent is quality of life being measured in terms of the efficacy?
There are certainly quality of life measures, or obviously measures for anxiety and depression, things like that. But those meta-analyses, they're very rigorous, and they account for a lot of other reasons why people may benefit or not, and so they really try and get a pure finding. And I think there are some times that research in the social science or in the psychological realm does not always support what we see with our eyes.
Gotcha.
I do some testing, some intellectual testing with patients who tell us that they have, chemo brain. They don't think this quickly. They're changed since they've been through chemotherapy. You do testing, it doesn't always show up.
Right.
It doesn't mean it's not real.
Right.
Right. It just doesn't show up in the best way that we know how to test the constructs that we've come up with. So certainly the research is needed. It's important. It helps guide us, and it can help give us support for, funding for programs, and we need more of it. But I don't think we need to be just blindly guided by the research findings and ignore what we see with our eyes and what we hear with our ears.
Yeah.
There is something, there's just something invaluable about this kind of support that we hear from people all the time.
Yeah.
So I think it is a balance of finding how the research matters and how much to incorporate that with our clinical observations and not to ignore either.
Right. Good. Good.
Yeah.
We do have a question. Can we get a link to the presentation handout? Absolutely. That's on the website right now. And if you go to that you'll see Justin right when you go to unccn.org, and you can go ahead and click on that, and you'll be able to access the handout there. For any reason you have trouble with that, email us at unccn@unc.edu, and we'll make sure that you get a copy of that. Let's see, what else? While we're waiting to see if other questions come in, so going back to the embedded, now I'm guessing, in spite of all the evidence around being married, you're not recommending that somebody who's not married run out and get married that minute.
No.
But with that said, are there, I'm imagining that there might be things that one could do to kind of beef up one's embedded network. Maybe the patient has children and has been attending more to the children and sort of losing touch with some of the other embedded networks. Maybe they've moved and lost touch with some family members due to that. So are there things that may be effective to help rebuild some of those embedded networks? And would that be effective if one were to do that?
I think that's a great question. It's I think really such an individual thing. I mean, families are complicated, to say the least. And sometimes people want to help, and patients don't want that help. And maybe that's the right call for them.
Yeah.
But a lot of times, I think there are people out there who could offer, whether it's whether it's not even emotional support, but whether it's rides to the hospital, someone to come to clinic with you, someone to sit with you during a long day in the infusion clinic or during a hospital stay. I can't say I've had a whole lot of. I'm trying to think back about patients who have maybe lost touch with people in their support network and then had those relationships kind of crop back up again. Mm-hmm. I do hear all the time people say, so this group of people, I would not have expected them to step up, and they've completely stepped up. And this group of people, I would have thought they would have been there for me more than they have, and they've just kind of disappeared. Mm-hmm. I think that has a lot to do with some people just feel more or less comfortable talking about cancer and death and coming to hospitals itself, and it says more about kind of people's comfort level than it does anything else. Yeah. But I think certainly what I do in a lot of my conversations with patients is talk about who they have in their life. Is there any more, who in their life would they like to involve more? Sometimes who would they like to involve less? Yeah. We hear lots of stories about in-laws or people moving in with them to help out, and that's a mixed blessing because they do need a ride, and they do need someone to cook dinner, and they do need all that, but they've also lost their privacy, and lost a sense of independence and freedom. So it's and I think that's probably what makes the research so hard, is because everyone is an N of one, and we can look at collectively kind of trends and large observations, but no matter what the research shows, it's almost an individual conversation with each patient.
Yeah. Okay. Another question came in. What's the best way for patients to find information about peer support groups?
Yeah, so I think that really depends on what you offer at your center. Certainly if they're here at Chapel Hill, we have a patient family resource center that patients come to, and then we kind of have a whole listing of support groups. There's that Immerman Angels for that kind of one-to-one peer support group. But that's a great question. And actually, it's kind of hard because sometimes there are local organizations that provide support in these kinds of support groups for certain patient populations, but we don't always know about them. Sometimes I'm still learning about. I'm like, oh, I didn't know we offered that. Yeah. So that's a good question. I think whatever area of North Carolina you live in, knowing and having a centralized kind of resource or list of what is offered. And updating that list. We have one here that's updated every few months because certain groups come and go.
Okay, good. We did have somebody mention unable to locate slides from link provided. Thanks. Again, just email us unccn@unc.edu. I apologize if for some reason that's not accessible today, but we'll go ahead and email that to you. So if cancer patient doesn't have a spouse, but a significant other, i.e. boyfriend or girlfriend, would you recommend that they be the support person to help with the psychosocial distress, sense of empowerment, et cetera?
Yeah, I mean, I think that's a conversation obviously to have with the patient. But there's nothing, just because you might wear a ring or have a marriage certificate, there's nothing magical about that.
Right.
It's just having someone who is committed to you and someone who's committed to your well-being.
Right.
So yeah, it doesn't have to be. I think that's the way that they look at it when they did that research, whether you're married or not, with the belief if you have someone you're married to, you have a official confirmation of a commitment. But there's nothing necessarily unique or empowering about that. I think advocates and support come in all shapes, sizes, and forms. And if someone has a boyfriend or girlfriend that they find to be a good support, absolutely, I would encourage that patient to think about bringing that person in as an advocate and to be there for big conversations. Especially that, because we talk about kind of social support in terms of emotional support, but there's also the informational support. And like I said, people leave those meetings, those kind of big talk meetings with doctors all the time and can't remember kind of half of what was said or specifics, and having someone else there that can say, well, I thought the doctor said this. Well, we should clarify. That leads to better treatment adherence, understanding of of what you're dealing with. That's a long answer to say yes. I think that as long as the patient sees this person as a primary support, then absolutely they should be encouraged to be embedded and involved in their care.
That's great clarification. This isn't about a marriage certificate. This is about a person in that role playing.
Yeah, and sometimes that's a parent or an adult child, or it doesn't have to be married, but it helps to have a person.
Good.
Whatever form that person comes in.
Well, we are running out of time, so I want to just mention a few things as we go ahead and wrap up. We want to thank the University Cancer Research Fund, the North Carolina General Assembly, for their generous support of Lineberger. We want to thank Mary King, Veneranda Obure, John Powell for all the work they do for this and all the other 28 lectures we put on every year, so thank you to them. Coming up, we've got Management of Acute Myeloid Leukemia in 2020, a paradigm shift for older adults, ? With Dr. Josh Zeidner. That's February 26th at noon. And then our next patient-centered care lecture is with Julia Rodriguez O'Donnell, and that's coming up on March 12th, also at noon. So we hope to see you for both of those. We always have new self-paced courses. These go up online. You've got a year. You can go there, recommend these to your friends and colleagues so that they can go ahead and take those and receive all kinds of free credit for those as well. Understanding Ovarian Cancer, that's our Cancer Conversations, our non-CE series, and that's coming up on February 28th at noon. So I hope you'll be here for that as well. Dr. Yopp, thank you so much.
No, thank you.
Really appreciate having you here.
Is amazing, and really taking on the role as kind of the, helping really spread information and support throughout this network. It's pretty awesome.
Well, we feel fortunate to do it. We feel fortunate to have you, our audience. We missed you. We haven't seen you in 3 weeks because of the extra week in there. So thank you. Please keep spreading the word, and we'll see you in a couple of weeks. Thanks, everyone.